the number one health show.
You're welcome back to Health Monitor, your guide to good health. This is the body care part of the show, and we are looking at health management organizations. Today we have here in the studio Lifecare Partners, and they are into health insurance or health management, okay? So I have here Dr. Olatunji Abimbola. You're welcome to Health Monitor.
Thank you very much, ma.
Okay, and I have MBI Cosmos. You're welcome.
Thank you.
All right, so I want you to educate my viewers. What is health management organization all about, or health insurance?
When we talk about health maintenance organization or health insurance, it has to do with ensuring your health ahead of any unforeseen medical circumstances. Okay, so basically what health insurance does is to prepare you against any unforeseen medical emergencies or medical events. So that is what health insurance is all about. You know, a lot of people don't actually prepare for sicknesses to happen, and then when it occurs suddenly, health insurance takes care of the fact that when you go to hospitals to access care, you don't have to make deposits before you access care. So you have the opportunity to access care immediately when you get to the medical centers.
Okay, there was a question somebody asked me, because we actually started this sensitization last week. The person asked me a question, said, what if I don't get sick and have been paying my health insurance premium? Is there any benefits whatsoever? Does it cover regular medical checks?
Yes, health insurance covers regular medical checks. So we do free medical checkups. Once you are under the scheme, you have opportunity to do free medical checkups. There's also what we call annual medical checkups once you are under the scheme. Basically, it covers all this, even if you have not fallen sick at all. So because health insurance is basically about preventive healthcare. So once you're on the scheme, we also take care of the aspect of preventing any medical illnesses.
Okay, let me come to MBI Cosmos now. You guys have won some awards, that's Lifecare Partners. What are you doing differently from other HMOs that got to the award?
Lifecare Partners HMO or Lifecare Partners Limited, over the last 10 years, have done pretty well in the healthcare space. And in 2017, we won an award that stood us out as one of the quality, assurance healthcare in organization. Now, what we have done differently in the industry is that over the years, we've designed innovative plans, and of course, we've designed plans that cut across the different strata of the society. And this means that even the market woman can actually get to enjoy some of the benefits that comes with our packages. And also, we've been able to touch like the tertiary institutions, students. We've been able to also provide insurance benefit for so many workforces, provide insurance benefit for even the unborn baby, in different families and also. So Lifecare has done pretty well by ensuring that the premiums are quite affordable. So somebody has not got a very good job, but can earn a living, right? So he has something in his pocket, can actually buy a plan or so that will suit his budget for the year. So Lifecare has been able to touch on every Nigerian, irrespective of their career, irrespective of their income, irrespective of whatever they do, but can have access to quality care. So when the award came to us, it wasn't really much of a big surprise, because we did, all the needful to ensure that healthcare is accessible by almost everybody in Nigeria.
Okay, so Dr. Latunji, I want you to please tell us what areas you cover.
In Lifecare Partners, HMO, we cover individuals, we also cover family. When we say family, we're talking basically about mother, father, and 4 biological children. That is what we cover. So we have flexible plans for them, whichever can suit their pocket. So from individual plan to family plan, that is what we cover.
And MBI Cosmos now tell us, the different plans, so that so that my viewers can know which plan, to take advantage of.
Okay, for our private our private health sector plans, what we've done over the years is that we've created an array of or a bouquet of plans. So we have what we call the basic plan.
Okay, what does the basic plan
The basic plan basically takes care of very primary healthcare benefits.
Like the market woman or what?
Yeah, like the market, because we're
or
looking
the
at
artisans.
like the artisans,
Okay.
the market women, association, affinity groups. Okay. So we actually have basic plans that can actually take care of the very basic need of an average, Nigerian that want to access care. So apart from the basic plan, we have what we call the standard plan. Now, standard plan is designed in such a way that if organizations who cannot afford our high-end plans, can come together, maybe 20 or above, they can actually have access to Medicare. So that covers quite a lot of benefits as well, including, even in the family plan, including antenatal and maternity up to a very appreciable limit. Now, we also have what we call the classic plan. The classic plan is a bit higher than the standard plan. The same goes for the comprehensive plan, of course, the emerald plan for the top-notch Nigerian citizen.
So, MBI Cosmos, how affordable is the care, is the plan? Okay, for example, the artisan, the market woman, how much do they need to start with? Okay. How much are they supposed to pay per month? Sorry.
All right. For the artisans and of course the market women and affinity group that we call them, because we're looking at the numbers, they are usually very large in numbers. So an insurance works with numbers. So if you have a number, there's a tendency that the cost will crash somehow. So for an artisan who has registered on board, they can pay as low as 1,500 naira a month
to access the plan.
The
basic plan.
The basic plan.
And the basic plan will cover what and what area?
Okay. For the basic plan, there's what we call the outpatient. So they can actually go to the hospital, see the doctor, consult with the doctor, and of course go with basic drugs. And of course, in some cases too, they might have to be admitted if they have admission-related issue.
Okay, does it cover malaria?
It covers malaria, covers, I know the normal typhoid, we say typhoid, it covers typhoid. And of course, in some areas where, of course, infections-related issues, they are covered. And even though dental is not covered, optical is not covered, but of course, if they have infections-related issues or pain, it can also cover up to that area. So it's basically pretty good for the masses, because we're talking about numbers here. So if I have a population of, say, 1,000 artisans cut across, let's say, Lagos State, for instance, we can actually get as low as 1,500.
That's
to
great.
have them on board.
1,500 is okay. I mean, for you to have the basic plan of health insurance to make sure that you get proper medical care when you need it. Because sometimes you find that you go for treatment and they want you to deposit some money before you can access care.
Yeah.
But with a Lifecare plan, for an artisan of 1,500 per month, you can access basic immediate care without having to go source for funds for you to access medical attention. I think that is great. Thank you so much, gentlemen and lady, for coming to talk to us on health insurance.
Thank you.
We're not praying that you're going to be sick, but what if you are sick and you need medical attention? If you register with Lifecare Partners, you get immediate attention. And of course, prevention is better and cheaper than cure. Thank you so much for being with us on this part of the show. Help Monitor will return shortly.
It's Help Monitor, the #1 health show.